welcome to our segment on evidence-informed health. Today we will discuss the common childhood illness, infectious parotitis, commonly known as mumps. It's a viral disease caused by a paramyxovidae virus that primarily affects the salivary glands, causing it to swell. It is also highly contagious. Christy Anderson will now provide you with insights into the causes and symptoms of mumps.
Go.
Hi Yusra, thanks for having me on the show today. So mumps is actually a virus which is spread via direct contact with the virus or airborne droplets. So someone may contract the virus if an infected person talks, sneezes or coughs during an interaction. Or alternatively, if an infected person sneezes or coughs, airborne droplets are released into the air where a non-infected individual can breathe in the virus. Mumps can also be spread by touching infected surfaces, so that's why it's really important to wash your hands after you've been out in public. Initially, someone with mumps may experience a headache or a fever, which are very non-specific, meaning it can be hard to diagnose early on. Within a few days, they may develop swelling in the salivary glands, muscle aches, fatigue, loss of appetite, or inflammation of the testicles and ovaries in adults. As I mentioned before, it can be really hard to recognise mumps, so it's important if you are feeling under the weather or experiencing any of these symptoms to go and see a doctor right away.
Thank you, Christy. Juliet Kernworthy will now discuss the treatments of mumps and the evidence-based approaches that parents or caregivers can take when treating or approaching treatments for mumps.
There is no specific antibiotic treatment for the mumps. Instead, health professionals focus on alleviating the symptoms and pain to the patient. Taking regular paracetamol to reduce the temperature and pain is highly recommended, as is using ibuprofen to reduce swelling of the glands and testes. Onto the subject of testes, applying a cold compress to the area to help alleviate pain and swelling, and also wearing an extra pair of supportive underwear to support the region is highly recommended. Hard foods should be avoided. Soft foods such as mashed potatoes, eggs and porridge, broths and soups are highly recommended. Drinking plenty of fluids such as water is essential. Avoid drinks such as coffee, soft drinks, and juice, as the high acidic content will further cause irritation. As a last result, some health practitioners may prescribe NSAIDs and steroids. These may help reduce the pain and swelling, but are only used in extreme cases. It is best to consult your GP or health professional before commencing any sort of treatment. This includes the regular taking of ibuprofen and paracetamol. It is also worth noting that you should never give aspirin to under 16s, as this is highly advised against. Prevention is better than a treatment, and you should make sure yourself and your family have received and are up to date on your MMR vaccination, which is measles, mumps, and rubella. Back to you.
Thank you, Juliet. In conclusion of this segment, if you are experiencing swelled salivary glands, fever, inflammation of the testicles or ovaries, or any of the symptoms Christy had mentioned, please see your GP to prevent any health complications. Also ensure to maintain good hygiene to prevent the spread of mumps. And finally, as Juliet mentioned, adopting an approach focused on alleviating pain and symptoms through taking prescribed medications, eating soft foods, drinking plenty of water, and avoiding hard foods and acidic drinks can very well treat mumps. However, it is important to note that you should always double check with your GP. I hope this segment has given you an understanding of the causes, symptoms, treatments, and evidence-based approaches for mumps. And yes, thank you for your time.